My name is Tavia Vital. I'm a registered nurse, certified diabetes care and education specialist with integrated diabetes services. And today I get to host our podcast. We are going to be discussing some of the details involved in what it's like when you have a child with type 1 diabetes, thinking about the diagnosis, how things start off, and then where you go from there and looking at things from a now perspective, looking back, amongst other topics, whatever we get to, we'll see. So, as many of you know, our team at Integrated Diabetes Services, we all live with type 1 diabetes personally, so myself included. I've lived with type 1 for over 40 years, and I have two kids. My oldest, who's now 17, was diagnosed with type 1 diabetes at age 12 in the times of COVID.
Welcome to Think Like a Pancreas, the podcast, where our goal is to keep you informed, inspired, and a little entertained on all things diabetes. The information contained in this program is based on the experience and opinions of the Integrated Diabetes Services clinical team. Please discuss any changes to your treatment plan with your personal healthcare provider before implementing.
Jessica, will you tell us a little bit about yourself and your daughter's story?
Yeah. Hey, Tavia. It's good to see you. My name is Jessica, and we're in Colorado here. And my daughter, Grace, who's now almost 8, was diagnosed at 4.5. She was halfway through preschool that year. Let's see. I do always love hearing other people's diagnosis stories. I'm not sure why that is. I think it's kind of a community and you're in the same boat, but it's probably similar to most other people's stories. 2 months after COVID, which was even a mild case of COVID, she started drinking a ton of water. And I remember those signs on the back of the pediatrician's door, which I still to this day, I have a note to email. There's a lady who actually created those and just had them distributed. So it's on my list to email her and thank her. So I put the dots together, but she started throwing up in the middle of the night and she wasn't sick. There was no fever. And that's when I realized there was an intuition there for me. I think I knew, but I didn't want to know, but I did rush to the ER. And even I told the doctor when we got there, hey, could this be type 1? I don't know how you test for that, and sure enough, we were transported
Amazing that they had flyers up that you saw at the pediatrician office and that you thought about it while your daughter was sick. So that's pretty interesting.
Well, and you always think when you see those flyers, those people, not us, but you're reading it because you're just waiting in the pediatrician's office and you're absorbing all the stuff they have on the wall. But I'm glad it was there because it was us.
Hey, Jamie, how about tell us a bit about you and your daughter?
Ellie was diagnosed at 21 months. It was just after Christmas. We thought for sure it was just a respiratory infection. Her breathing was off. She did vomit from time to time, but at that age, it just kind of gets chalked up to, oh, she's got a virus from daycare so we didn't read too much into it. And then her breathing continually was off. So we thought, well, let's take her to Emerge to get checked out. And so we took her, I think it was 8 o'clock at night, and it was during COVID. So we didn't even have a doctor come in and visit us for the first 4 hours that we were there.
Wow.
So here she is, 21 months old. It's midnight. So I said, we're going home. Like, I can't sit there all night with her. So then the next morning, I had to work at the hospital. And so my husband brought her in. And of course, he couldn't leave her to go to the bathroom or anything. So on my breaks, I would go down to the emergency and sit with her so he could at least go pee or stretch his legs or whatever he had to do. Well, near the end of my shift, she was diagnosed with a respiratory infection and severe constipation. We left the hospital, got home, and he was home, separate vehicles because I was at work. And by the time I got home, her lips were white and we rushed right back. They didn't even make us triage again. They just took us right back. And the doctor that was on, he pulled down his mask because everybody's wearing masks during COVID, smelled her breath and said type 1.
Wow. Gosh.
So we didn't even have blood work done until the very last visit. So 3 trips to Emerge in 36 hours. She was in DKA. Our family doctor said that if we waited another 24 hours, we would have lost her. Same thing. She was drinking lots, wetting through diapers. I'd even change her once, twice through the middle of the night thinking what is going on here? Yeah, she's drinking more. Does it make sense? I even have a cousin who's type 1. Her other side of the family is they have some type 1s in the family. So I didn't even know really the signs and symptoms to look for because she was diagnosed at age 7 and that was like 30 plus years ago. So yeah,
My
it was
son my
scary.
son's story is a little different because since I have type 1 diabetes and I'm a diabetes educator, I know about research studies that are looking for screening risk for type 1 diabetes. So my kids had already been enrolled in a variety of research studies since birth. I actually took cord blood and tested and know that both of my sons have the high risk genes for type 1 diabetes. So due to that, then we could choose to enroll in other studies. So we were in a study called TEDdy that monitored blood tests every 3 months. And we brought in tons of samples of other things that they collected throughout the study. And it's from birth until age 14 or until someone converts to having type 1 diabetes. And so I already knew that my oldest son, Isaiah, he already was making antibodies. So he started making antibodies when he was a toddler, and his A1C started creeping up when he was a young child. And then we did whatever we thought we could do to try to intervene, right? Whether any of it worked or it just was how his body worked, who knows, right? But we did the higher doses of vitamin D and vitamins and omega-3 and probiotics, and we tried all the dietary things that at that time, not 5 years ago, now like 17 to 15 years ago, that we read about may or may not help reduce risk, right? So we were doing all the things we could possibly try to do to try to prevent it from really kicking in. And he really, I mean, he went 10 years with antibodies before his blood sugar was high enough to diagnose him.
I guess I'll start by saying my older brother was diagnosed type 1 when he was 15. And I was about 13. So from the going through the experience of him being diagnosed, I was aware of the signs. In the back of my mind, for some reason, I kind of thought that it was just older kids or like around puberty, which I think is more common, but I kind of had the wrong idea that that's just when it happened. So I was sort of like, oh, that's like something we'll have to worry about eventually. Tom was 2.5 and he started, you know, being super thirsty, peeing all the time. There's the classic symptoms. It's funny. I feel like I enjoy listening to diabetes podcasts and, hearing all the stories. And I feel like I did the same thing that a lot of parents did, which you like justify it in your mind, right? Like try to find the reason. At that time, it was April. It was just getting nice out. He was peeing outside a lot. And I was like, oh, he's just, he likes peeing in the yard. He's like a little boy, just like having fun doing that. And then it kind of got to a point where I was like, okay, it might be like, it's like a lot of peeing in the yard. It might be too much. It rained one day. And so he was peeing in his little potty. And I, for the first time in a few days, got a visual of how much he really was peeing. And I think it was probably like the third or fourth time that I emptied his little potty that I was like, I realized. And I feel like I knew immediately. And you start thinking back through your head. I all of a sudden realized that he had been super like lethargic, and I recognized then some of like the weight loss, and just went to the kitchen and Chris was cooking dinner, and thank goodness Chris is such like an easygoing person. Because I remember being like, go to you need to leave right now and go to the pharmacy and get a finger test. And he was like, really, like right this second. Like, I was like, yeah, right this second. And thankfully he just turned off the stove, headed out. He's the best. Tested his finger. Sure enough, it was high. We're like, got out the directions. We're like, what does HI mean? What does HI mean? Thankfully my parents live very close. My mom headed over and she had been through it before. So she was like, was able to kind of prepare us. So like we packed a suitcase while she gave him a quick bath, headed to the hospital. So Tom's our oldest. And yeah, he was 2.5 at the time. And then our second is Joe. He's the youngest. He was 5 months old at the time. So, loaded up Joe, loaded up Tom, went to the hospital. You're off to off to the races. And yeah, and I guess I can just tell the story for Joe also. It was actually kind of crazy because it was almost exactly 1 year later. Tom was early April. Joe was just a few weeks later, so a year and a few weeks. For him, I mean, we were just kind of on the lookout. He was 18 months. I actually had like the trial net box sitting on the counter because we were like, all right, when he turns 2, we're going to do that. But we were definitely, you're just on the lookout. And I remember it was just one night he was walking around just with a diaper on, and we noticed, Chris and I just sort of like both looked at each other. We're like, that's a big diaper. Chris grabbed the finger kit, but you're not ever really thinking, you're like, it's not going to happen to us, Test his finger. Sure enough, it was like 170. And I think we kept testing after that. I think he had like just had dinner, and it went to, I think, up to 300. But then by the time we got to the hospital, it was down. I think he was just in like the 90s at that point. But obviously, I mean, night and day. Like I feel very lucky that we had a full year with just Tom. We had our feet under us. Like, I mean, it was surreal. It was horrible. But I mean, we were just like, all right, let's like, we've done this. Like, let's do it.
One of the hardest things for me as a parent that had no experience with type 1, you go through, or I don't know if everyone goes through this, but you just are trying to figure out why it happened. You're trying to make sense of where it came from. And you go through this reel repeatedly. I would say the first couple years, to be honest, I did. You want to solve the problem, or you want to know why it happened. But that was kind of where I was at those first couple years. I never slept because I was so lost trying to get it all figured out and knowing everything depended on me. I started drinking alcohol more. I mean, I wasn't a big drinker before, but I convinced myself that was helpful to numb myself to get through 12 to 15 shots a day. I am a perfectionist, so diabetes was especially difficult because it's not perfect. Yeah. You can't control it, and you can't, no matter how much. I mean, obviously the work you put in is reflected often.
We should clarify something. I just thought about this. Jessica, you said 12 to 15 shots a day. You mean finger pokes and insulin injections, not shots of alcohol per day.
I was thinking that too. Like,
I was like, I better just back this up a little bit and
I'm
just
a small person.
make sure we're clear.
you handle it well.
No, I isolated myself. I was already an introvert, but just dealing with the trauma and the massiveness of it's just an enormous disease to manage. And you can't,
It's just consuming.
It's all consuming. You go into a vortex, and you basically don't have the energy to try to teach people or to think that they can understand. So, or at least I didn't. But then on another front, I would also talk about it all the time. I think I kind of became the diabetes mom or the diabetes lady. And I don't think there was a way around that. I'm a little embarrassed looking back that, even at the grocery store, I would talk to the clerk and it would come up as they were checking the extra vegetables that I was getting. Oh, well, I have to get these because my daughter just got diagnosed. And
because you needed that connection somehow.
Someone
it's not like an easy, you were just like anybody that could be within earshot trying to reach out and make a connection somewhere.
Yeah.
That makes sense.
And then the other thing that I did, which looking back made it harder, was I tried to launch back into normal life. I tried to just pretend like we could just jump back in. We could sign up for those summer camps when she's 4.5 years old and everything could work. I would just have to be there somehow doing 12 shots and not alcohol shots, managing everything from the sidelines, yet my life would continue on as normal, and I think
and you would keep doing all the things you did as a mom and as an adult along with all the diabetes things, and you can make it work. Yeah.
I was everything was going to go back literally like the next 2 weeks. It was just, we got this, we can handle this, we're going to steamroll forward. Obviously, all those factors combined is just a kind of a disaster. Looking back, I don't
Slap in the face.
realize what a disaster I really was. But yeah, we made it through it.
Well, at the time that Ellie was diagnosed, so this was just over 4 years ago. So Ellie was diagnosed, and I think it was 3 days later, my husband was diagnosed with PTSD from work. He's a police officer. Me not knowing what his triggers were, what was going on with him, what his therapy, like he's an introvert himself. So he kept that all to himself. So I felt like I didn't want to put more on his plate. So I just took over everything and, don't worry about it. I got it. And I could feel myself getting like more and more wound up, like tighter. Like something was going to give. I'd cry in the shower. That way he couldn't see. Yeah, it was everything. And of course, she's 21 months old. So trying to eat, what can we give her? What is she going to eat? How much do I bolus? Did I give her enough food for the insulin? Did I give her enough insulin for the food? Like it was just all consuming. So I ended up being able to take, I think it was 37 weeks off for critical illness leave. Her pediatrician signed off because of the age that she was at and just because it is life changing. I mean, as much as you want to pretend that, oh, yeah, you can still live with it and it's normal, when it's brand new, there is no normal. It is like walking on lava. So here in Canada, cannabis is legal. So I actually did get a prescription from my doctor, tried that to just kind of relax at night, just take some of the weight off. Thankfully, I didn't become too dependent on it. Like every 3 or 4 days, maybe step outside. But yeah, that wasn't working. So I just stopped that. It was a long, long first year.
When I started working at IDS, I noted this common theme that you guys are sharing. Your experiences were totally different with the diagnosis story, right? The way that you guys arrived at the diagnosis is different. The ages of your kids, different. But you have this common thread of that initial overwhelm. It's just huge. And the feeling that you can't get it right no matter what you do, and trying to find connections and feeling isolated. It's a part of being a parent, diabetes or not. And then you throw diabetes in there, type 1 diabetes, and then it's sort of like, it's like exponential, the amount that you can feel. You had no idea that you could feel this many feelings all at once, right?
I was working with a lot of young people as a diabetes care and education specialist. And not that I thought parents were like exaggerating. I just thought in some scenarios, maybe like they weren't actually accurately carb counting or were inserting something incorrectly or, just or making excuses of like
Sure.
some different things. And then I took on an opportunity to become kind of like a clinical nanny to a family. And when I moved down, I came from Pennsylvania into Florida to help with them in person. And he was 3 at the time. And I very quickly learned that everything is it's all just crazy. Like it's one day is truly different from the next in these little ones. And you have to learn to adapt and adjust and know what to do with settings. And you just have to be okay with sometimes things just not making any sense whatsoever for what the reason is behind some of these blood sugar outcomes. Like you do everything right is such an exaggeration with these little ones. You do everything right and everything goes wrong. It's just kind of frustrating.
I call it the worst science experiment ever. Never ends. You never know fully how you're doing with it, and it can change at a moment's notice. So what worked on the first day isn't going to work on the third day, and it's going to change again by the 10th day.
Especially like the first year with Tom, I feel like whenever his blood sugars were erratic, I was always like looking for like a reason, like something to blame, like, oh, maybe he's getting sick or maybe this is honeymoon. I think it's hard to say. I know that Joe he's just always been a lot easier to manage. Tom's blood sugars are much more erratic. Joe is much like more of like a slow rolling wave. They both, which that's actually been a really surprising thing with both of them, is how different the management has needed to be for both of them. I wasn't really expecting that. I kind of thought with Joe, I was like, oh, it's going to be the same thing. And it definitely wasn't. But I think it's been easier overall, which is nice.
I think the lows, for me, when he has a couple days in a row or a series of lows, a day where he's like low and he has to fix it, low and he has to fix it. And he's pale and he's sweaty and he's weak and he can't do what he wants to do. And I get super upset. I stop and I talk with him and see how he's doing and make sure, the diabetes side of it's cared for. But I'm checking in with him on how he feels after dealing with all that, because firsthand, it's scary. It doesn't feel good. It makes you angry, like you as the person with diabetes. So I'm expecting that from him. Or if not, that's okay too. Great if he doesn't really care. But I just want him to know that he can talk to me about those things, because I grew up my whole life without that. No one knew what I was going through.
Right. Yep.
And I think so when I see him really low, it gets me every time, because I'm just like, oh, he feels lousy. I'm not scared for his safety because I know we got this.
Yeah.
But I just hate that he has to experience that.
Yeah.
Makes me frustrated.
Think Like a Pancreas, the podcast, is brought to you by Integrated Diabetes Services, where experience meets expertise, passion meets compassion, and diabetes care is personal because we live it too. Our team of clinicians, all living with type 1 diabetes, understands the challenges firsthand. We're here to help no matter where you are in the world. From glucose management to self-care strategies, the latest tech, sports and exercise, weight loss, type 1 pregnancy, and emotional well-being, we've got you covered. We offer consultations in English and Spanish via phone, video chat, email, and text. Want to learn more? Visit integrateddiabetes.com or email info@integrateddiabetes.com to schedule a consultation.
I sought out other moms who had gone through this, pretty recently to us. I would say some moms who may have older kids with type 1 might not be as helpful if you've got a toddler and they're
Different.
it's just a little different. So, try to use your network. There's great Facebook pages. I luckily had a couple of moms that I knew of that I reached out in the hospital. And so they recommended a good endo and it was a much better fit for us. So yeah, you are the mom, you know your kid best. So if they are as young as Nate and you don't feel comfortable with some of the things that they might be doing in the hospital as the doctor, speak up. Especially diabetes. We know as type 1 diabetics that a lot of the work is on you and great trusted advisors that you can get on your side, like Integrated Diabetes. I think I reached out to you guys coming home from the hospital and Nancy was like, why don't you wait a day or two? And I'm like, no, I'm getting on the calendar. When's your next availability? Seek help. So it's not all on you to kind of ease that burden.
I feel like all I did was cry on that in those groups. I feel bad for the people that
That's what happens to everybody. I mean, not everybody, but at least one, if not 2 or 3 people, when we have a good group size, it's a place where you can breathe, and
be heard.
you know that nobody on there would be like, what is the matter with her? Type 1 is not that hard for your kid.
I
you as a
have
parent.
a neighbor actually, and she has a little guy who's type 1. And next year, our 2 will be in the same class. We've actually asked for them to be in the same class so they can kind of, learn from each other. And there's nights, here's another low. So it's nice to have that so close.
We decided to look into getting an au pair, and that has been life-changing. I know it's not possible for everyone, but it's way more affordable than you think, and it's way more accessible. We had both of them. It was actually on she basically got here on our 2-year diabetes anniversary for Tom, 1 year for Joe. Wow. That has been life-changing. It's just been such a gift to breathe and to have that break. I mean, now they're in school half day, but also just kind of bridging that gap before they're in school and having that help. We're at the point where she just knows she's in the house all, with us and is in the routine. And it's crazy. I think she handles lows better than I do.
When Nate was diagnosed, I think we went into that same mode of just a team and really, taking a step back after leaving the hospital and both of us coming together and being like, you know what, this is how I know I will be with his numbers in the day-to-day outside of the hospital. He kind of shared, this is how I think I will be. And let's figure out a good way where we're not stepping on each other's toes and we can kind of make the right decisions for him because he's 2.
I think that was hard for me and still is how relationships have changed after the diagnosis based on how or lack of involvement, lack of interest, lack of just general
Knowledge.
understanding. You just I can't leave her with even my own parents. And so I haven't reconciled that in my mind yet. I don't know if I ever will. I guess you accept it, which I have, but it doesn't make it easier or less sad. I'd say about 6 months ago, I just kind of took a turn and I was like, that's enough. How can I be a better role model and a better caretaker? I think it's human nature, just naturally, hopefully want to be better than we are or were. And then, so that's when I stopped drinking. I started cooking more meals on the table. So I can't say, I guess her numbers got better, but it was more as a person, finally had the capacity to, I wouldn't say take better care of myself, but just notice that I could be better. And you stop trying to make sense of how it happened, why it happened. The anger subsides. Every conversation when you see people, you're not trying to somehow configure diabetes in. In fact, at this point, I actually make a point of trying not to talk about diabetes. I learned to, especially for her benefit too, is seeing it. And I think I learned this from some of the group work that we did at IDS and
Yay.
seeing things more as data If a day is really bad, I used to beat myself up. It would just be, I couldn't stand to see the numbers. But now it's like, okay, let's look back at the day. What could have gone better? And not calling the school all the time to, just kind of, all right, this happened today. We're going to try again tomorrow. And that's become a lot easier. Have you guys heard of that poem, Welcome to Holland? I worked with, so there's another podcast called Sweet Talk. He introduced me to this poem, Welcome to Holland, and it's by Emily Kingsley. And it basically talks about a parent with a child with a disability and how you think you're going to Italy and you're so excited and you got all the tour books and you got on the plane, but then the plane lands and you're in Holland. And you're angry and you didn't want to be in Holland. And then, as you can imagine, it goes into the details of you now have to open your mind up and let go of the fact that you're not in Italy in order to enjoy Holland. And that was actually extremely helpful for me. I read that poem, I reread it, and it helped me kind of move forward into Holland. You just get better. That's what happens.
Yes. So the diabetes doesn't get really easier. It changes all the time. And there are always curveballs coming at us.
You're going to be forced to get better. You're forced to get better.
You get tougher. You get skills under your belt, and you get more confidence with what needs to be done and the acceptance of it doesn't need to be perfect because there is no perfect.
I have to say, our last trip to Emerge here, one of our nurses was type 1, and the doctor that was on said to us, because she saw that we're 4 years in, what do you need? Not, well, we're going to try this and this. It was, what do you need? Because she knew that we'd been doing this so long, we probably had a better idea than she did. And that was so comforting.
Because I think in the very beginning, you can't have that. You can't. You have to go through all of the emotions and the knowledge that you need and the practice of it and the skill building and the repetition to get where you are. This session was a really nice time to reflect back on what things were like when our kids were first diagnosed with type 1 diabetes, what it felt like early days and the things we struggled with, and that common thread of just that overwhelm and anxiety and anger.
Thanks for tuning in to Think Like a Pancreas, the podcast. If you enjoyed today's episode, don't forget to like, follow, or subscribe on your favorite podcast app. On behalf of Think Like a Pancreas, the podcast, I'm Gary Shiner, wishing you a fantastic week ahead. And don't forget to think like a pancreas.